I've worked in healthcare for my whole life. I always have told people that when you're sick, you should never think about the cost of healthcare. Doctors I know are not thinking about how much the cost of care is that they're giving, and patients should not be thinking about the cost of the care that they're getting. And certainly not in this moment, and not with something that could be deadly. So I wasn't thinking about the cost at the time. What I was thinking was I was really concerned that I might die. For the last 15 months, I've been undergoing chemotherapy and radiation for lymphoma, which is a cancer of the white blood cells. So I had Medicaid, but my husband had accepted a job offer. We were getting ready to move to DC, and I had unenrolled in Medicaid when my husband signed for his job and signed up for his health insurance, because that's what the law requires. And, I just happened to be uncovered at the exact moment that I got sick. So about 5 days after I got the final test results, it came in an envelope, and I have an online bill as well. They sent it to me right away, and I opened it, and I was in shock. So my total bill was about $34,392. I'm saying that precisely, but it's somewhere between $34,000 and $35,000. And some of the sort of memorable costs that are associated with it, like the COVID-19 test panel was $907. And great, that might get paid for by some magical way, but that's 2% of the total bill for my care. Everything that the doctor and nurse who are treating me in isolation could possibly need has to be in the room waiting for me when I arrive at the emergency room. It has to stay in isolation, and then until they get a positive or negative test, anything they put in the room has to be billed to me because it has to be thrown away if it doesn't get used. And that's a very expensive process. Working class people in the US can never catch a break. You get sick once and your credit is ruined and you have this huge debt. I'm early on in this pandemic, and there are going to be a lot of other people. And I want people to know up front that we have to organize now when Congress is talking about all these big bailouts, that we have to reach out to them now if we want to make a change. I received excellent care. I'm here and alive today because our healthcare system is amazing and the cost is outrageous. And that's not a political problem. It's not, it's not doctors' faults. It's not patients' faults. It's a political problem that we have.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.